Please stand by. Good day and welcome to the NCD Alliance webinar. Today's webinar is being recorded. At this time, I would like to turn the webinar over to Jess Beagley, Policy Research Manager at NCD Alliance. Please go ahead.
Hi everybody, and thanks ever so much for joining the latest NCD Alliance webinar. It's great to have you on the line. This webinar will be dedicated to a summary of discussions and outcomes on the NCD-related agenda items that came up at the WHO Executive Board that took place at the end of January. This was pretty high profile for NCDs, especially with the discussions around the WHO General Programme of Work and around the UN high-level meeting on NCDs. NCDA also released our campaign priorities during the EB, and Elena will be discussing a little more about that. This webinar will be a bit shorter than our webinars usually are. It's only an hour rather than our usual hour and a half. And this time we've only got internal NCDA speakers, so we look forward to resuming our normal service in March with a much wider range of speakers and topics being covered, but we hope that today is useful for everybody. Just to run through the agenda today, if we could have the agenda slide up and showing. So we've got the 13th General Programme of Work, the high-level meeting on NCDs, as I just mentioned, but also the high-level meeting on tuberculosis, which also relates to our own priorities. Then a brief summary from me on health, environment and climate change agenda item, and then from my colleague Lucy on physical activity. And finally back to Elena, who will be covering nutrition, access to medicines and health. So without further ado, I'll pass over to Elena, who's going to walk us through the first items for today. Thanks, Elena.
Thank you ever so much, Jess, for this wonderful introduction, and a very warm welcome to everyone spread out across the globe, dialing in late or early. It's a pleasure having you on this intelligence-heavy update on the WHO Executive Board, which took place in Geneva from the 22nd to the 27th of January. On this first page up front already, if you want to peruse any of the documents that came out for the Executive Board, any of the decisions and resolutions, they're available on this link here. You can also still rewatch individual discussions if you want more detail on what specific member states said. It's quite a useful tool. I don't know how long it still will be up, but I checked today and it's still running. And then there's also a link here to all of our statements if you weren't able to read them before. We published these before, they're not new, or also if you want to go back to some of the positions that we took in greater detail. Just to say as well that as always, this webinar is recorded and we will make available the slides and the recording to you after the webinar. Give us a couple of hours and then it'll be up on the web, and all of the links that are included will be live then as well. So if you try to click some of the links now, they will not be active, but you can use them afterwards in the PDF version of the webinar. Next slide, please. I will start with the agenda item that was most certainly at the heart of this Executive Board, the WHO's 13th General Programme of Work, which is a WHO strategic plan for the next 5 years, starting in 2019 and running until 2023. We've talked to the General Programme of Work in previous webinars, so I will try to not repeat too much, but just to say that the GPW focuses on what is called the triple billion targets, a number of strategic parties and big organizational shifts that the WHO is planning to undertake. It's admittedly rather or deeply ambitious, and during discussions at the Executive Board and also beforehand, Dr. Tedros has made very clear that he believes that delivering on the triple billion targets is not just WHO's responsibility alone, but that achieving the targets was rather a shared goal between the World Health Organization, other organizational partners, including other UN agencies, and member states themselves. He also made very clear that WHO will not do things that are not included in the general program of work, which is quite an interesting statement to make, as surely this will mean that a lot of us will fight even harder to make sure that our priorities are included in the GPW, and it's going to stay an interesting space to watch until the adoption of GPW 13 at the World Health Assembly. Next slide, please. I wanted to very briefly share this slide, which I find helpful in terms of understanding what WHO, or Dr. Tedros, wishes to see come out of GPW 13. You can see here under outcome 4, NCDs included as NCDs prevented, treated, managed, and their risk factors controlled, and mental health prioritized and improved. Great to see this link between NCDs and mental health made here. We also see as outcome 7, another priority area of ours here, also impacts of climate change, environmental risks, and other determinants of health addressed, including in small island developing states. And throughout the outcomes, you're seeing a greater focus on strengthening country and regional capacities. Next slide, please. The process of revising the 13th General Program of Work continued since the special session of the Executive Board in November and continued at the EB, resulting in several amendments. And in fact, the version that you can find online now on the Executive Board webpage is actually already a revised version that includes the direct amendments that were made at the Executive Board. I just wanted to go back. Some of this we talked about before, but some of this is new. The revised drafts since November include a couple of changes, mostly are really very positive for NCD. So under Platform 2 of the Strategic Priority Healthier Population, we have, the strategic priority is exclusively focused on NCD prevention. In particular, the targets or the aims here mentioned are to reduce the use of salt and sugar, eliminate artificial trans fats and antibiotics in food, reformulate food products, reduce tobacco use and harmful use of alcohol, stop the marketing of unhealthy foods and beverages to children, and a reduction of prevalence of physical inactivity. But it's quite important to understand the strategic priority is really exclusively focused on NCD prevention. It's quite interesting, and logically it makes sense, of course, to put NCD treatment under the strategic priority of universal health coverage. But, and this has been one of our advocacy messages from the beginning, is that we need to make sure that we really balance NCD prevention and treatment, and that NCD treatment doesn't disappear under the UHC strategic priority. And we're still calling for a more explicit focus on scaling up the best buys for treatment of NCDs under the General Program of Work's focus on universal health coverage, and this will remain a focus of ours for a while. There's very much to our liking a stronger focus on physical activity and also nutrition. Nutrition is something we specifically advocated on at the Executive Board. We're still waiting to see the impact framework to see how the inclusion of physical activity has translated into any concrete targets. And there's also a stronger focus on a life course approach to health and NCDs, and in particular aging here, and improved palliative care language, including a standalone paragraph, which I believe is still paragraph 38. Next slide, please. There was also a financial estimate, a very short one that came out for the Executive Board, which estimated the cost at $10.8 billion over the 5-year period. There were quite a bit of discussions on how GPW 13 would be funded, and there's different strategies here, none of which are, to my knowledge, fleshed out in detail. There's a lot of talk about greater in-kind support from member states. Tedros has been calling for the unearmarking of funds for a while, and he's also been talking about new donors. The EB resolution recommended that the World Health Assembly may approve GPW 13. The resolution, however, specifies that this does not include the financial estimates, and requests that the outstanding work on the impact framework and the financial estimate and also an investment case would be finalized for the World Health Assembly, so that these pieces of work can be then discussed by member states. So it's quite clear that GPW 13 is not final yet. I believe there will still be quite a lot of discussions between now and certainly at the World Health Assembly as well, and it's a space that we'll be closely watching and updating you on. Next slide, please. Obviously, one of our priorities at the Executive Board, both for the official agenda but also for member state discussions and meetings on the sidelines of the Executive Board, was the report on NCDs and the preparations for the UN high-level meeting on NCDs. While many member states welcomed the serious tone of the report, member states such as New Zealand or the United States do not really approve of the critical stance that the report took, for example, on weak political action, lack of policy coherence, and quite a strong couple of lines on the interference from commercial interests. Just to recap, the EB report highlighted the main barriers to implementation of the WHO's best buys, which we were very pleased with, and in particular highlighting the weak political action taken at the level of head of state, heads of government, still the lack of access to essential medicines and vaccines, and lagging behind of integration of best buys into national universal health coverage schemes, rather weak national regulatory and policy capacities, most in particular in low and middle income countries, no alignment between international development cooperation and national NCD responses despite demand for it, and then these rather strong paragraphs on both industry interference but also on high-income countries protecting commercial interests in global policy negotiations. The report cautions that the consultations on the outcome document for the UN high-level meeting could default to a scenario that is same or even worse than the current version, so really ringing the alarm bells here and pointing out how much more consensus member states have to form for a successful UN high-level meeting, and it recommended that member states discussed how to remedy the shortfalls in international support for NCDs, and also that they explore an allocation of a percentage of tax revenue from multinationals that are based in high-income countries from the sales of unhealthy commodities in low and middle-income countries for official development assistance or NCDs. Next slide, please. Just a couple of, I wanted to give a bit of a snapshot from regional and country statements on the report. The regional statement of the African member states focused on the lack of regulatory, legal, and technical capacities and the challenges of industry interference in the region, but emphasized that their obstacles were really mainly of financial nature. The PAHO statement, which excluded the U.S. did not want to align with this regional statement, underlined the strong commitment to action in the region and called explicitly for bolder commitments at the third UN high-level meeting on NCDs. There was also a resolution that Uruguay had tried to get off the ground ahead of the executive board, but there was a very, very clear message from the U.S. that they would not support this resolution to welcome the Montevideo roadmap. And it's important to know that there was a resolution on tuberculosis and the ministerial conference on tuberculosis last year, also welcoming the outcome document of the ministerial conference, and Uruguay was trying to do something similar with the parallel process of the Montevideo conference. The EU member states, plus a couple of member states that aligned with their statement, really highlighted that for them was still the four main risk factors, but also environmental degradation and climate change that they wanted to see as the main focus for NCDs. The Nordic and Baltic countries said that they heard the report's message loud and clear, and also highlighted that civil society, including patients and including consumers, should be heard in the UN high-level meeting process. The Eastern Mediterranean region called for more granular discussions to build consensus on outcomes for the high-level meeting. Several member states requested more information on the high-level meeting, and I can also say that on the sidelines of the official deliberations, many member states expressed strong support for the high-level meeting to be held back-to-back with the high-level meeting on tuberculosis, and that it should be held in September. But also voiced concern over the lack of consensus on the expected outcomes of the meeting. Bahrain again underlined how important this particular report was and requested that it be submitted to the World Health Assembly, which I guess isn't always the case. And Thailand called for a greater focus on commercial determinants and the political economy of NCDs. Next slide, please. In terms of the responses from WHO leadership, Dr. Chris Etienne, the regional director of PAHO, gave a very impassionate response to member state interventions, calling them to imagine how countries would react to a calamity such as the crash of 99,000 jumbo jets full of people, which apparently is the number of people that die from NCDs each year, which obviously is quite an impressive analogy. And she said about the NCD response that that so far it's been too little, too limited, and not equitable. Dr. Svetlana Axelrod, the Assistant Director General for NCDs, called on member states to see the NCD and TB high-level meetings synergistically, and also highlighted mental health in the context of the high-level meeting. And then DG Dr. Tedros insisted in his response that progress on NCDs was not slow because of a lack of evidence-based solutions, but for lack of action and political will. And almost probably to illustrate his point, he read aloud the list of member states that have ratified the protocol to eliminate illicit trade on tobacco, which will require ratification by 6 more countries, as I understand it, before it becomes an international treaty. And he challenged member states, in particular executive board members, to ratify the protocol before July's deadline. Next slide, please. So while all of this was going on in Geneva, in New York, Italy and Uruguay were appointed as co-facilitators for the high-level meeting. And as co-facilitators, they will shepherd member states through the negotiations of a modalities resolution, and also through the negotiations of the outcome document itself. We know now that the translation of the UN Secretary General report on NCDs is slightly delayed. I believe it will be discussed later this month or early March, which meant that the negotiations on the modalities resolution have been pushed back as well, and we understand that they will start on the 12th of March in New York under the leadership of Italy and Uruguay. And currently the dates for the high-level meeting that are being discussed are the 27th or the 28th of September, following the high-level meeting on tuberculosis. But we know that there is pushback from the US on this, who wants the meeting to take place in July, which is rather problematic from our perspective. And we strongly encourage you to keep reaching out to your governments and to keep making the point to your government contacts that we absolutely have to have the high-level meeting in September. If you have never heard of our process priorities for the modalities of the meeting, please visit our website. They're available here, there, or reach out to us, and we can help you with that. But please keep advocating for strong modalities. Our EB statement, by the way, as well, emphasized these points to member states. Just a last point on the EB itself, it was interesting that Italy remained entirely silent throughout the discussions, which is interesting given that they will assume such an important role. I recall that Italy is sort of taking a bit of a conflicting stance, for example, in the WHO Best Buys at the World Health Assembly, and is understood to be rather close to the US, who on occasion has said that they don't want the high-level meeting to be all that successful. And Uruguay obviously came out rather strongly, highlighting the importance of the Montevideo Roadmap as input in the UN high-level process, and kind of reaffirming their commitment to this whole process. Next slide. All right, so now while member states' discussions on the high-level meeting at the executive board, but also still now are very much focused on the modalities, including the date of the meeting. NCD Alliance published our campaign priorities during the executive board, and we will be increasingly shifting gear toward advocating on outcomes once modalities are agreed, and we're shifting to the discussions on outcomes around March or April. If you don't know yet, the High-Level Commission on NCDs, that is led by Dr. Sonia Nishtar and President Tabaré Vázquez, also announced that it has now 5 co-chairs and 21 commissioners. All of these are available on the WHO website. Katie Dane, our CEO, is a commissioner, and we're also expecting the membership of the WHO Civil Society Working Group, which we are co-chairing, to be announced this week. This process has been a bit delayed, but hopefully it will be finally announced this week, which we're very excited about. Now, a couple of words on the NCD Alliance campaign priorities, which we launched during the executive board, and you can find on our website. And as I said before, the links on the slide will be active. The first link, campaign priorities, will lead to a longer document that really fleshes out all of the background and detail on the campaign priorities, and we also have a one-page infographic available in different languages and related resources on the UN high-level meetings, such as FAQs and a model, a template presentation that you can use as well. So these NCD Alliance priorities for the UN high-level meeting campaign were identified through consultation with our global network members, with experts, and through a public online survey to build consensus and priority actions to be taken by governments to accelerate progress on NCDs. While we focus on 6 priority areas, these are largely framed around boosting investment for NCDs and accelerating implementation of a set of low-cost, highly cost-effective interventions across prevention and treatment of NCDs, which, as you know, are called the WHO Best Buys for NCDs. Next slide, please. I haven't talked to these on our webinar in greater detail, so I'm going to take a couple of minutes to do so now. As I said, we have 6 campaign priorities that we've identified to address key bottlenecks in the NCD response, and also to build on existing momentum of good practice that we're seeing in countries. So this first campaign priority is to put people first. Really speaks to the fact that the UN high-level meeting isn't just about big numbers, but it's about the very real impact that NCDs and NCD risk factors and determinants have on the lives of people living with, at risk of, and affected by NCDs. We believe that people living with, at risk of, and affected by NCDs, young people in society, must be at the heart of the NCD response. And to date, we feel that the empowerment and involvement of people living with NCDs and young people has been undervalued in NCD program development, in implementation, and also policy making. And generally, people living with NCDs are underrepresented as leaders in organizations and largely silent in the decision-making processes around NCDs. So it's our ambition that the UN High-Level Meeting Outcome Document really puts people at the heart of the response, upholding their rights and responsibilities through supportive political, legal, and social environments that give all people the opportunity to speak up, especially the most vulnerable and disenfranchised. Next slide, please. As you will surely agree, scaling up for investment for NCDs, which is our second campaign priority, is absolutely fundamental for moving the needle on NCDs, especially in low and middle income countries. However, and again, this is unfortunately no news to any of us, sustainable and adequate resources for NCDs are severely lacking, delaying action at the country level. NCDs receive just about 1.3% of development assistance for health, making NCDs the only major global health priority without international financing. And this is obviously completely at odds with the burden NCDs place on countries around the world. So in closing the resource gap will require multiple financing sources depending on the country-specific context, and the result will likely be a blended stream of financing, including creating and optimizing fiscal space for NCD investment domestically, exploring innovative financing mechanism, including the taxation of unhealthy commodities, multilateral and bilateral funding, private sector funding, and catalytic mechanisms in line with the recommendations of the Third International Conference on Financing for Development, which was held in 2015. And we underline that while domestic resource mobilization is critical for low-income countries allocating less than 5% of GDP to health, progress on NCDs will be impossible without catalytic funding from donors. Therefore, we believe that the UN High-Level Outcome Document must highlight global consensus on how to boost investment for NCDs and include robust time-bound commitments to turn global recommendations into tangible results. On our next webinar, we will be updating you on several processes that are ongoing on financing for NCDs or investment for NCDs, including the financing conference that WHO and NCD are hosting in April, the Bloomberg Task Force on fiscal policies, and some of the work that WHO is doing that will be unveiled at the World Health Assembly. Next slide, please. Our third campaign priority is focusing on childhood obesity. We believe that childhood obesity is an issue with very clear health, economic, and equity imperatives for action, and that it's also increasingly garnering public and political attention worldwide, which we're hoping will benefit our calls for action for the UN High-Level Meeting. We have global political targets to ensure zero increase in overweight and under 5s, and also the Global Monitoring Framework for NCDs target to halt the rise in obesity and diabetes. And we also have an excellent resource in the WHO implementation plan to end childhood obesity, which promotes a set of population-based interventions that we fully support. We highlight here under this campaign priority that the root causes of childhood obesity really lie outside the health sector and are driven by a lack of policy coherence in the food system, very powerful commercial interests, and unhealthy food environments. And childhood obesity is an issue which we believe has potentially very high returns on investment if, but really only if, coordinated action across sectors of government is taken, and as such really requires urgent high-level political attention, which is why we've made it one of our campaign priorities. Also important to understand, obviously, that any action we take on childhood obesity really is action on obesity, period. Next slide, please. Our fourth campaign priority is phrased as adopt smart fiscal policies that promote health, and it focuses on the public health dimension of fiscal policies on healthy commodities such as alcohol, tobacco, and sugar-sweetened beverages, or SSBs, that result in real increases in the price of these products. Raising excise taxes to significantly increase the price of these unhealthy commodities are globally recommended evidence-based interventions to lower consumption and improve population health. And while we focus on fiscal policies recommended by the WHO Best Buys, this concept can be easily expanded to include fossil fuels, for example, and other unhealthy commodity driving NCD risks through air pollution. For tobacco, the call to action on raising excise taxes is already a legally binding commitment under the WHO FCTC. And beyond being a public health intervention in its own right, tobacco taxation has also been included as a recommendation in the Addis Ababa Action Agenda for Sustainable Development Financing. And taxing unhealthy commodities is acknowledged there as being good for health and also good for government revenues. Around the world, we already see governments dedicate revenue from taxation of unhealthy commodities to health promotion and health systems financing. And while we understand that this might not be feasible or desired in every country context, and very much depends on how specific governments approach taxation, every country in the world should tax unhealthy commodities for public health reasons, as it is a proven, cost-effective intervention that lowers consumption and thus also risk. Next slide, please. All right, fifth priority is access to treatment and care. We believe that access to treatment and care is a fundamental human right for everyone to achieve the highest possible standard of physical and mental health and well-being. Availability and access to life-saving treatment, care, and support for people living with NCDs, as you know, is still out of reach for millions of people around the world, particularly in low and middle-income countries. And this is particularly true for the world's poorest and most vulnerable populations. And this all is despite the global targets for 2025, we're in 2018 now, to ensure 80% availability of essential medicines and technologies for NCDs in public and private facilities, and also a specific target on multi-drug therapy for cardiovascular disease and diabetes. Particular issue we see also as the insufficient access to controlled opioids for pain relief and palliative care. Challenges of access relate to weak health systems in many low and middle income countries, including the lack of adequate preparation and training of the health workforce, insufficient financial resources, poor procurement policies, and weak supply chains, inefficient information systems, and lack of patient education and low health literacy. And so our fifth campaign priority, framed as saving lives through equitable access to NCD treatment and universal health coverage, seeks to highlight that reducing the burden of NCDs is essential to achieving universal health coverage. It's also fundamental to achieving the UN Sustainable Development Goals, particularly goals on ending poverty everywhere and reducing inequalities within and among countries. Next slide, please. So on this sixth priority, we often get the reaction from member states that we already have enough targets and indicators to measure progress. However, as we've learned from other global health challenges, accountability, especially independent accountability, is a crucial force for political and programmatic change, and we believe that we don't really have a well-working system for accountability for NCDs. Accountability really most broadly enables the tracking of commitments, resources, and results, and provides information on what works and why, what needs improving, and what requires increased attention. And thus, accountability ensures that decision makers have the information required to meet the health needs and realize the health rights of all people at risk of or living with NCDs. So while multiple sets of commitments and targets for NCDs exist at the global level as set out in the Global Action Plan and the Monitoring Framework for NCDs, the 2014 UN Review Outcome Document, and the Sustainable Development Goals, we suggest that these existing WHO and UN accountability mechanisms for NCDs be complemented by independent accountability mechanisms to accelerate progress against the global targets. This is something we've been working on for a while, and we're seeing finally some progress here. And additionally, at the national level, we see a pressing need to strengthen accountability mechanisms, national targets, and improve data collection and surveillance systems. And then finally, We will also be advocating that we will set a new date for the next high-level meeting on NCDs, ideally in 2023 or 2024, before the review of the 2025 NCD targets as an important end goal in itself and a milestone towards the 2030 SDG targets. Next slide, please. Before I will pause for some questions and answers, I quickly wanted to talk to the agenda item on TB at the Executive Board. There is a slight mistake on the slide. It should say EB resolution. I apologize. And the EB resolution requests the Director General to develop a draft multi-sectoral accountability framework for monitoring, reporting, review, and actions needed to accelerate progress to end tuberculosis. And it also urges Member States specifically to support the preparations for the high-level meeting on tuberculosis this year and to implement the commitments that they made in the Moscow Declaration to end TB last year. So a couple of updates as well from New York on the process for the first high-level meeting on tuberculosis. The negotiations on the modalities of the meeting have now begun in New York. Possible dates are being discussed as 26th or 27th of September, keeping very close tabs on this to make sure that we keep pushing for this back-to-back TB and NCDs meeting, which we see really as a One Health opportunity that we hope Member States will agree to. All right, I will pause here for questions and answers.
Thanks ever so much, Elena, for covering all of that so smoothly as always. We had one comment/question come in, so we'll pick up on that. But I'd really encourage anybody else who's got any questions at all on everything Elena just covered to type them in the chat box, and we'll be glad to answer them. So Elena, one question that came in from Anne Radsky from ISN. She'd come across an article mentioning that a July date for the HLM. And this was from some local press in Ghana, but I just wondered if you could go into a little bit of detail on the different sources where people should be looking for any updates on changes in date for the HLM.
Sure, that's very interesting. I'm going to have a look at the article later on. Rather concerning to hear about the July date. So as I said, most Member States that I talked to during the Executive Board and also all of the discussions that we've been having in both Geneva and New York, most Member States agree that the meeting has to take place in September. I understand that that's really broad consensus at this point. Obviously, there's difficulties in terms of finding a date since the time around the General Assembly high-level segment is always very popular. But as I said before, too, the U.S. is actively campaigning against that to happen, and they want a July date, such as the one that we had in 2014. The reason why we don't want this is that it's very unlikely to get the high-level attention that we want, and we really believe in having the TB and NCD meeting back to back. In terms of information, obviously we'll be updating you as we hear new things. The date of the meeting will only be agreed in March. It's worthwhile reaching out to your government contacts, but at this point there's only a very small set of people that are very closely following the discussions on the date for the meeting. So if you have any particular questions, feel free to reach out to myself or Priya Kneeson in New York, and we can give you the download on the latest discussions. I believe it's fair to say that we have very accurate information as we keep very close contact with the co-facilitators and the Office of the President of the General Assembly in New York, as well as WHO colleagues working on this matter in Geneva and New York.
Thanks again, Elena. Another question that came in from Louise from WCRF is what's the reason for July from the US's perspective specifically?
Yeah, so I don't want to be such a downer on the US certainly, but they haven't made a great secret out of the fact that they don't want a very successful meeting. And July is the strategy of pulling the meeting earlier than expected, which will then kind of compress the negotiations and get everybody in a mad rush and reduce the time that we have to build consensus. We know that the High-Level Commission on NCDs will only publish their report with recommendations, for example, in June. And if the meeting was in July, there was no way that these recommendations could even be reflected in the outcome document, as usually the outcome document of a high-level meeting is finalized about 2 months before the meeting itself, and then it can't be touched for about a month, I believe. So it would really, really mess with the progress. So I'm kind of sad to say, but the reasons are mainly to not make the meeting very successful, which obviously they might not say so officially, even though we've had quite frank, bold conversations with people in New York and Geneva, and they obviously have very, very different standpoints on a lot of issues related to NCDs, but first and foremost the best buys.
Thank you again, Elena. And two more, one from me and one from Elizabeth Carl, who's on the line. So I was wondering, in general, what everybody on this webinar can be doing to ensure that the HLM is a success, either in the preparatory process or the meeting itself. And then the question from Elizabeth Carl was specifically for the mental health community. She's asking how mental health actors are involved in the preparatory process and how they could be further involved. And that includes mental health professionals, academia, users of services in general, globally, regionally, and nationally. Thanks, Elizabeth, for that question.
Yeah, thank you very much for that question. I was just emailing with a mental health colleague who you know very well. Since this webinar is obviously public, I won't go into much detail. But we, as NCD Alliance, very much recognize that we still have a lot of work to do to ensure smooth integration or a better sort of involvement of the mental health community in this whole process. And we've started conversations with WHO on this, and we are beginning to reach out to begin and deepen this dialogue. We also open to slightly revise our campaign priorities to just make sure that we have sufficient focus there. And we're quite pleased to see that, or to know that the UN Secretary General is obviously very supportive of mental health, that the likes of Dr. Vikram Patel are included on the UN High-Level Commission on NCDs, and that there are some other commissioners, such as the Minister of Health of Russia, that I understand is quite a strong supporter of mental health. So we're quite pleased with that, and we've also lobbied for representation from the mental health community on the WHO Civil Society Working Group, which, as I said before, we're hoping that the membership will be published this week. But we really, really welcome any outreach from you, and we see this very much as a two-way conversation. We don't necessarily think that we should just say how mental health should be included in this meeting, since it's acknowledged as a priority, and rather really welcome open dialogue with the mental health community, and we'll be reaching out more. Actually, Elizabeth, I'll send you an email later on just to update you on the discussions I've been having, as I'm sure that will be of interest to you.
Elena, the questions are still coming. So if we take the 3 that are currently in the box for now, and then any others we can address at the end of the webinar.
Yes, why don't we? I am very mindful that we are running late, and so maybe we'll just move on to the next presentation, such as yourself, and then we'll just see what we have time for later on, and otherwise we can always follow up over email. But I'm excited that there are so many questions coming in, and this is not to, I do want to answer them. It's just that we are struggling with time, as always.
Thanks, Elena, and thanks to everyone. So we will come back, and we hope that you can stay on the line until then. For now, I'm afraid we're moving on to me, not as chair for now, but to speak a little bit about environment, health, and climate change. So this agenda item was really well engaged with. There were 50 statements by 35 member states, and also statements from the ILO, from WMO, and from 6 non-state actors. So yeah, fantastic to have that level of multi-sectoral engagement. The discussions in the EB followed on from the adoption of a resolution at the UN Environment Assembly in Nairobi in December on environment and health, which had 5 key areas, including chemicals and waste, climate change, biodiversity, antimicrobial resistance, and sustainable consumption and production, which is the theme of SDG 12. And following that, WHO and UNEP also signed their own agreement to make the work that they're doing collaboratively more formal. The focus of the EB discussions were impressive in that they took a more integrated approach than previous EB and WHO discussions on environmental health have, which are normally focused on air pollution specifically. The statements were diverse and interrelated in terms of the issues that they raised. This spanned air, water and soil pollution alongside climate change, and also made a reference to the very many threats that environmental and climate change pose to health, including natural disasters, NCDs and communicable diseases, of course, rising sea level, food security, conflict, forced migration and poverty. WMO also noted in their own statement that 2015, 16 and 17 are the 3 warmest years ever on record. In terms of member state priorities, there was significant debate around the action plan, which I'll talk a little bit more about in the decision, should focus specifically on small island developing states or also other vulnerable settings. Obviously there are limited resources and a number of small island developing states are very concerned that the focus might go beyond those who have the most urgent need, and argued that once good practices had been established in small island developing states that they could be scaled up to other settings. So there was a proposal to have the action plan focused on climate change in small island developing states initially, and subsequently other vulnerable settings. There's a need for intersectoral and multi-stakeholder action. This won't be news to anybody on this call, but it was great to see Malta on behalf of the EU highlighting the need for co-benefit actions. Meanwhile, we had the US stating that energy, environment and transportation sectors should be involved only if and when significant evidence was available to demonstrate the impacts of decisions in these sectors on global health. So that was slightly more discouraging. If we move on to the next slide, also on member state priorities, you can see that the health sector is widely acknowledged as having a role in advocating to and informing other sectors, but there was also acknowledgement from member states that the health sector is part of the problem and should be held accountable. I know in the UK and particularly there are disturbing statistics on just how much greenhouse gas emissions can be attributed to the health sector. Zambia called out the need for innovative financing mechanisms both at national and international level, and they welcomed WHO's request for accreditation to the Green Climate Fund. WHO is now a registered observer to the Green Climate Fund, so that's good news. Lots of member states mentioned specific vulnerable populations in their statements, whether those be women, older people, people living with diseases already, or indigenous communities. Some helpful language came from Malta, which will be great for mobilizing a wider movement around environment and health, because they pointed out how climate change and environmental degradation undermine human rights. Sri Lanka and ILO really drew on the links between environment and climate change, but with workplace and occupational health. Sri Lanka pointed out how workplaces have a great influence on the environment, but how the environment also influences billions of people in the environments that they work in. Some other points from the US that are worth mentioning, if not hugely encouraging, are that the US mentioned that the report misstated some key facts, and that the claim in the report that multinational companies pollute developing countries is unjustified, since those multinational companies adhere to more stringent protocols. The US also questioned the role of environmental health in preventing health emergencies and advancing global health security. To move on to the decision that was adopted at the EB, this contained 4 requested actions for the Director General. Firstly, to develop the draft action plan I mentioned earlier for the platform to address the health effects of climate change, initially in small island developing states. And for this to be submitted for consideration to WHA 72, and that's obviously aligned with the general program of work. Second, to develop a draft comprehensive global strategy on health, environment and climate change to be considered by WHA 72. Both of these first two action points were supported in a number of the member state statements that were made. Third, to ensure that the regional committees are asked to comment and provide input on the draft comprehensive global strategy mentioned in the second action there. And this really reflects a lot of the discussions that took place in the EB when statements that were made on behalf of countries and regions referred to discussions that had taken place at regional committee meetings that were relevant to the broader discussion on global health, environment and climate change and should be reflected in the documents that are being pulled together. And finally, to prepare a report on actions taken on the interlinkages between human health and biodiversity for consideration by the 71st World Health Assembly, and that's in order to prepare WHO's contribution to the 14th Conference of the Parties of the Convention on Biological Diversity. I know that my colleague Lucy is very pushed for time, so we'll move straight on to her. Okay, Elena is apparently going to cover Lucy's agenda item because Lucy needs to rush, I'm afraid. So Elena, if you're happy to cover the physical activity agenda.
Absolutely fine. I'm going to move on to physical activity, no problem. Physical activity is another agenda item that featured rather prominently during the Executive Board, both as an agenda item pivoting around the draft global draft global action plan and physical activity, and also with WHO really walking the talk at this meeting with regular dance breaks, thanks to the rather direct and persistent reminders from the Thai delegation, who brought up this point several times. It's great to see all of these board members and WHO leadership walk the talk. We had a statement together with the International Society for Physical Activity and Health and the International Union for Health Promotion and Education, where we obviously commended the action plan and welcomed the extension of the target to reduce physical activity from 10% to 15% by 2013, which was also strongly supported by member states. We echoed concerns around resourcing, but also urged caution around partnerships with industries that undermine efforts to achieve health. For those of you that work in the NCD risk factor space, obviously you understand that physical activity is often used to distract from action on unhealthy diets, and if you've followed at all the joint public letter that we did with IOGT and GAPA on the Global Fund's recent partnership announcement with Heineken, you may understand that we take a strong interest in what we see as incompatible partnerships from an NCD perspective. Next slide, please. So for the resolution at the Executive Board, the resolution calls to finalize a monitoring and evaluation framework on implementation of the Global Action Plan, including a set of process and impact indicators by the end of 2018, to produce a first global status report on physical activity by the end of 2020, and to also incorporate reporting on progress made in implementing the Global Action Plan on physical activity in the reports to be submitted to the Health Assembly in 2021 and 2026, to submit a final report on the Global Action Plan on physical activity to the Assembly in 2030. There's also a request for WHO to update the 2010 Global Physical Activity Guidelines. Next slide, please. In terms of next steps, we look forward to the endorsement of the Action Plan for Physical Activity at the World Health Assembly, and we're also very pleased to hear that Dr. Tedros has announced movement that engulfs the world to take place on the eve of the World Health Assembly and look forward to joining and mobilizing civil society. And we'll share more details as soon as they become available. We voiced our support publicly at the Executive Board for this activity, and think that it's really really great to see this happen. Quite a different attitude to activities at the World Health Assembly than what we've seen so far. Next slide, please. All right, moving on to nutrition. At the Executive Board, it was quite important to see, as I already mentioned under the GPW discussions, that the EB elevated nutrition as a priority for the general program of work. There's now a stronger focus on malnutrition in all its forms, including breastfeeding, and also WHO and FAO-led efforts on the UN Decade of Action on Nutrition. The member states noted the extension of the World Health Assembly nutrition targets from 2025 to 2030 and improved 4 remaining indicators of the Global Monitoring Framework on maternal, infant, and young child nutrition. Member states also noticed in a separate agenda item WHO's proposed approach to safeguards against possible conflicts of interest in nutrition programs. There was a bit of discussions here with a number of countries welcoming this tool and expressing interest in piloting the tool. I believe that was Nigeria, for example, Thailand, Philippines, and India. And then, as was to be expected, also some pushback from countries such as the US that called for further consultations with member states on the topic. But I understand that we're moving forward into the testing phase of the tool, and I look forward to following these discussions with those countries that have expressed interest in piloting the tool. Next slide, please. A really, really big focus of the Executive Board is access to medicines and vaccines, and member states, as always, were united on the importance of access to medicines to achieve universal health coverage, but widely diverged on how to address the issues, such as in previous World Health Assembly discussions, previous Executive Board discussions, and very long negotiations led to a decision addressing the global shortage of access to medicine that requests the Director General to elaborate a roadmap on programming of the WHO's work on access to medicines and vaccines, including activities, actions, and deliverables for the period 2019 to 2023. There was also a decision on the global strategy and plan of action on public health, innovation, and intellectual property. And for everyone who really wants more detail on all of this, there's an excellent article on DEVEX that I've included here that goes into a lot of the nuances and details. Next slide, please. Finally, health. Member states recognized in a decision really the potential of mental health to transform health systems by bringing health closer to the people and improving the connectedness between hospitals and primary healthcare facilities through electronic health records. They noted that mHealth was a component of strong health systems and not a replacement for traditional health services. And noted the great potential to leverage mHealth to address NCDs, both in terms of prevention and self-management, and almost all member states emphasized the need to develop strong regulations for data protection, and understand that there will be a resolution on mHealth, which was initiated by India, and this resolution will be discussed at the World Health Assembly in May. Next slide, please. The Executive Board also agreed the provisional agenda for the next World Health Assembly. There's a link there. The date is the 21st to the 26th of May, and there's a theme this year, which is universal health coverage. And then, as per usual, the World Health Assembly will be followed by another short session of the Executive Board, which will take place on the 28th and possibly also the 29th of May. Next slide, please. Our next webinar will be held on the 21st of March with updates on the UN high-level meeting and possibly also already a confirmation of the date. pending obviously the negotiations of the modalities resolution in New York, starting on the 12th of March. We'll provide much more detailed campaign updates and also updates on financing for NCDs and related processes, updates on the WHO High-Level Commission NCDs, which is really only now kicking off its work, and by the 21st of March we should have a lot of updates here as well, and then also the WHO Civil Society Working Group, whose membership hopefully will be announced this week. Thank you so very much, Jess. I'll hand over back to you.
Thanks, Elena. So we haven't actually had any questions on the second half of the webinar. And I know that there are a number of questions that came through in the first half that were related to specific disease priorities, so we'll definitely follow up on those afterwards. But just while we wait and see if any questions do come through on the second half of the webinar, Elena, there's a question from Bayer at IDF asking if we know approximately when in March the HLM date will be finalized.
We don't know when it will be finalized. We know that the discussions start on the 12th of March, and then it really depends on how quickly member states can come to agreement on the modalities resolution. So I guess depending on how hard that will be for them, I'm hoping that it wouldn't take longer than 2 weeks, but it's hard to say. What will help is that we have now ongoing the modalities resolution discussions on the TB high-level meeting, which is likely to kind of specify or narrow down the options for dates for NCDs.
Thanks, Elena. And then a question from Beatriz from the Inter-American Heart Foundation class. Is the G20 connected in some way to the UN HLM? I'm happy to take that one.
Sure, go ahead.
You've got something else. So Beatriz, the G20 is not formally connected in any way to the UN HLM, but we're hoping that it would be an opportunity to build momentum in those countries for some of the priorities that we have towards the HLM, and Argentina would obviously be a great ally to have in those discussions. Elena, I don't know if you want to add more than that.
No, I mean, just an encouragement to highlight the linkages to or the importance of the high-level meeting with G20 member states. I think a lot of these high-level processes, we know that they're largely focused on universal health coverage, but we've also heard that there's some interest in elevated childhood obesity, for example, and I think it's just important to kind of keep raising NCDs as a high-level priority, even if we know that probably we can't expect that it will be like the prime focus of the G20.
Thanks, Elena. And the final question that isn't related to a specific disease priority is in the first slides. When we were discussing the scope of the HLM agenda, the question is whether the participant understood correctly that it would be limited to prevention and control only, and that treatment will be relegated to UHC and not included in this HLM. So I can pick up on that. So treatment will very much be part of the HLM. The point that Elena was covering was on how treatment features in the general program of work, and not the HLM. But treatment will be very much part of the HLM discussions. And we've had a few more questions just come in. Also on the HLM, one from a participant called Kelly, wondering if people with NCDs will be presented and speaking and raising issues at the UN high-level meeting.
That's a really great point. So one of the really important parts of the UN high-level meeting process that I didn't speak to today because it's not a high-level meeting focused webinar is the civil society hearing, which is an informal hearing where civil society gets the opportunity to speak and to be heard by member states, and we are advocating for this informal hearing to take place in June if the high-level meeting takes place in September. And this is really a place where we are planning to make sure that we have very, very strong representation from people living with NCDs, as this meeting still has, there's still an opportunity to influence the outcome document. At the high-level meeting itself in September, the outcome document, which is really one of the most important aspects of the high-level meeting, will already be pre-negotiated. So while the high-level meeting in September itself is important, it's important that we get heads of state, heads of government there, that we have a lot of representation from civil society. The really important part of the process to be inputting in is the development of the outcome document, including the sort of high-level opportunity of the civil society hearing in New York, and then obviously also throughout the process in direct advocacy with member states. So we're really trying to support also our regional and national network. For those that don't know, there's over 55 national and regional NCD Alliance that are working very hard in support of our work at the global level in terms of making it relevant to their regional context, in terms of making it relevant to their national context, in terms of plugging it into processes such as the G20, the Summit of the Americas, and similar processes around the world. And if you're interested in getting more involved with that, please email any member of the team, and we'll be really happy to include you in more of that work. Also, the WHO working group for civil society, the main mandate of this group is to kind of coordinate efforts across the civil society space and with WHO to make sure that the process around the high-level meeting is as successful as it should be. So really calling on heads of state and heads of government to get involved and mobilizing across the different regions for attention and action.
Thank you so very much, Elena. We know that there are still a few more questions in the chat box, and we are now sadly out of time, -8 minutes. So we will follow up with those questions by email. But for now, thank you ever so much, everybody, for joining the webinar. And we look forward to speaking to you again on the 21st of March, if not before. Thank you. Bye for now.